And other news this morning, prostate cancer. 33,000 men die of prostate cancer every year, and every year 20 million get the PSA test that's supposed to detect the disease early. But a top government panel says the test itself may do more harm than good. Dr. John LaPook reports.
For 20 years, the message has been the same. Get a PSA test every year or two, detect prostate cancer early, and save your life.
Hold that right there.
Dr. Michael Lefevre helped lead the panel that said the message was wrong.
The problem is that in contrast to the small benefits, a significant number of men will be harmed by the tests and treatments that follow prostate cancer screening.
The task force said the PSA is unreliable, giving a falsely positive result 80% of the time. Prostate cancer is typically diagnosed in older men, and the disease usually progresses so slowly they die of something else. The panel is among the most influential in the country. It cited an 11-year study of over 180,000 men. The study showed more than 1,000 need to be screened to detect 37 cancers and prevent a single prostate cancer death. The options for men with prostate cancer include radiation, surgery, hormones, or simply observing. Side effects of treatments include erectile dysfunction and urinary difficulties. Lefevre says the consequences can be even worse.
Ultimately, we'll find that 2 to 3 men out of those 1,000 will in fact have a serious complication such as heart attack, stroke, blood clot, or even death.
The recommendation sparked fury at the annual meeting of the American Urological Association. In a statement, the group said it was outraged and that the recommendation was inappropriate and irresponsible.
I do not believe that the medical evidence in any way supports this conclusion.
Dr. Herbert Lepore is the head of urology at NYU Langone Medical Center.
PSA has taken us down the road to decreasing the risk of prostate cancer death. We all recognize we got a long way to go to perfect screening, but the last thing we need to do is turn back.
We have been taught for years to fear cancer and that the only hope is early detection and treatment. And so for both doctors and patients alike, it's difficult to accept that some cancers don't need to be discovered and don't need to be treated.
African Americans and men with a family history of prostate cancer are at increased risk of the disease. Even so, the panel says there's not enough evidence to recommend screening in either of these groups. Dr. John LaPook, CBS News.
I found a powerful new way to cut up